If someone already drinks green tea, why does a tiny capsule suddenly get marketed like a metabolism upgrade? Are we talking about the same body signal, or did the supplement aisle turn a beverage into a different exposure?
Different exposure is exactly the issue. Green tea is a drink made from Camellia sinensis leaves. Green tea extract is usually a concentrated catechin product, often standardized around EGCG. The body does not just ask, what plant? It asks how much arrived, how fast, with caffeine or food, and whether the liver has to process a large pulse. Mechanistically, EGCG and related polyphenol can interact with oxidative stress pathways, inflammatory signaling, gut microbes, and enzymes involved in energy handling. That sounds huge, but it is mostly upstream biology. Upstream biology can support a hypothesis. It does not automatically predict pounds lost, better sleep, or a visible anti-aging result.
So, when a label implies fat burning, what should people expect in real life? Is there a group where green tea extract makes sense, or is the strongest effect just that caffeine makes a diet feel more energetic?
I would frame it as a small adjacent tool, not a weight loss driver. Catechins plus caffeine may nudge energy expenditure in some contexts, but the packet's stronger modern evidence does not show a clean clinical transformation. In a one-year randomized trial subset, high-dose green tea extract did not significantly lower CRP, IL-6, or TNF-alpha in postmenopausal women with overweight or obesity.
Would the smarter move often be brewed tea instead of a capsule? If someone wants polyphenol for general cardiometabolic eating patterns, does the cup give most of the upside with less of the weird dose problem?
That is a reasonable default. One of the more interesting benefit areas is not rapid fat loss. It is the gut ecology signal from polyphenol-rich diets. A 2026 review and meta-analysis found polyphenol intake was associated with higher bifidobacterium abundance, though with high heterogeneity. Green tea appeared among the studied food sources, not as proof that every extract product does this. But this is where the cup capsule distinction becomes medically important. Concentrated green tea extracts have been linked to liver injury, especially with high catechin loads and fasting-style bolus use. If someone has liver disease, abnormal liver enzymes, heavy alcohol use, or unexplained nausea, dark urine, right upper abdominal pain, or jaundice, this is not a casual experiment.
What about caffeine? A lot of green tea extract products talk about EGCG like it is the only active ingredient, but people may also be stacking coffee, pre-workout, and diet pills. Should caffeine change how they interpret benefits?
Yes, and it can confuse the story. If someone feels more alert, that may be caffeine, not improved metabolism. For sleep or mood claims, the evidence is even more conditional. A small insomnia pilot using a drink with chicory and green tea extracts did not improve objective sleep or quality of life versus placebo. A broader flavonoid review found some mood signals, but mixed foods and methods make green tea-specific claims fragile. A useful label check is total green tea extract, EGCG amount, total catechins, caffeine, serving size, and whether the directions imply taking it without food. Many labels emphasize plant origin while hiding the practical pharmacology. If the EGCG number is absent, the person cannot compare the product to the evidence or to known safety discussions.
If a healthy adult still wants to test it, who is the best fit person? Someone replacing sugary drinks with brewed tea, someone using a low-dose beverage-like product, or someone trying a high-dose capsule because the scale stalled.
The lowest friction choice is brewed tea, if caffeine is tolerated. For capsules, ask a clinician first if you're pregnant, trying to conceive, breastfeeding, have liver disease, take medications with liver considerations, are preparing for surgery, or combining multiple supplements. NCCI's general supplement guidance is plain. Products can differ from studies and can interact with medications or medical conditions.
How would you judge whether it is helping without fooling yourself? If the realistic effects are small, what should someone track so they do not mistake caffeine buzz, water weight noise, or a new diet for extract magic?
I would set a short, conservative trial only if the person has no red flags. Keep calories, training, sleep schedule, and caffeine steady. Decide in advance what would count as benefit, and stop if there is no clear improvement. For weight, look at a multi-week trend, not single mornings. For energy, separate morning alertness from afternoon crash or insomnia. And the stop signals should be non-negotiable. Yellowing eyes or skin, dark urine, severe fatigue, persistent nausea, abdominal pain, itching, or unusual bruising. Also stop for palpitations, anxiety spikes, tremor, or sleep disruption from caffeine. Do not restart after a suspected liver reaction unless a clinician has evaluated it. Re-challenge can be dangerous.
So the filter is, enjoy green tea as a beverage if it fits you, be skeptical of extractive fat loss marketing, and treat high EGCG capsules like a dose decision, not a wellness decoration. The body ladder here is not anti-green tea. It is anti-confusing a cup with a concentrated liver-handled bolus.